Hello, it's Dr. Elizabeth Alter. Well, today I'd like to review some of the medical headlines that I thought were interesting. So I get these emails with um, medical news on a regular basis, and I thought it would be good to share the insight on them with the functional medicine twist. So here from family medicine. I'm board certified in family medicine, so that's the kind of news I receive. So it's mostly primary care. Um, so one of the headlines is cases of rare flu related um, acute necrotizing encephalopathy increase among children. So apparently, uh, there's an increase in the number of kids who get flu related um, condition to their brain where they have this necrotizing. Necrotizing means death of tissue. It's rare, but apparently it's going up. Um, and I always remind patients of the importance of helping kids with their immune system. I think a lot of times we think that children are resilient, but giving them some basics like a multivitamin C, D is important as well. But of course, if your child has the flu, you may want to look out for this. Of course, it says it's rare. So there were only 41 cases between 2023 and 2025, but of course, um, no one wants their child to be that 41 in the 41 cases or potential cases of this. Then the next headline is States see more cases of hand, foot, and mouth disease. Now, this is a viral condition. So apparently they're seeing more of this than in years before. And this is a highly contagious virus. It says here often spread at daycares and summer camps. And unfortunately, there is no specific treatment for it. Um, most kids recover on their own, and there is a slight risk of brain swelling and viral meningitis. But again, this goes to trying to keep the kids healthy, keeping them away from sugar as much as possible. Sugar is such a immune system damper, right? And then we have obesity, diabetes in youth may affect bone health, of course. So sometimes when um, whether it's a child or an adult, when they're big, we tend to think that their bones are strong. But if they are overweight from lack of mobility, then hence, of course, their bones are going to be weak. So the more athletic a person is, the more resistance training, the less diabetes they're going to have, and the stronger bones they're going to have. So to me, this one is a bit of common sense here. I'm not sure you needed a study to figure this out, but sometimes these studies find these connections. So it's good that it's confirmed. But of course, the last sentence of the blurb is larger studies are needed to confirm the findings. But to me, if I see a young adult um, who or child who is um, has extra weight on them, has sugar issues, already I know that those bones are destined to not be strong. Um, and then this one's a bit obscure. Case report links beta HPV to skin cancer. Um, so HPV is human papilloma virus. Um, Apparently, if you have it and you're immunocompromised, you can develop some sort of skin cancer. It doesn't say specifically which one, but this one's a bit out there. I wouldn't worry about this too much, but again, HPV is an immune system issue. So the stronger your immune system, the less HPV is going to give you an abnormal pap smear, cancer, things like this. Especially green tea extract, I find is very good. with this, with an HPV issue. So here's a good one. Living near green spaces may reduce developmental risks. And again, this one's for kids as well. And of course, I mean, um, it's funny because I was a latching key kid, meaning, I was home most of the time. Um, Obviously, when I was old enough to stay by myself. But you think about how important it is for kids to be outside, and I think now with it's not just that if you live in an urban area, but it's the devices and electronics that keep kids from being outside. But of course, um, the more you're outside, the more you're moving, the more you're using your brain in different ways for a kid. So, so yes, I think this one again is obvious. Living near green spaces is going to reduce developmental risk in children. Um, and um, here they have they always in this medical news they have a blurbs about practice management. So here they have commitment needed to reform prior authorization, right? So how many times do you need a procedure and they call you and they say no, it needs pre-authorization, so the doctor has to fight with the insurance or a a sort of clerical person who's non-medical at the insurance trying to convince them that you need a procedure or medication. So apparently they're trying to reform that. I guess mostly for Medicare, but usually when something happens in Medicare, it spills into mainstream insurance. Um, and And this one's interesting, and I'll probably end with that one. AI, digital tools transform patient trust in healthcare. Um, I'm really concerned about AI. Um, I see so many good things and some negative things, and I think eventually, especially in primary care, they will replace us doctors with artificial intelligence. Um, and it's funny, I always think about it when a patient tells me they need an antibiotic when they've only been sick for a day or two. I know that they can wait it out. It's most likely a virus, and they argue back and they belittle sometimes. And oh, you don't want to give this to me, and you want me to get worse. And but when they have AI as a practitioner, there's going to be no arguing with the computer. So AI will just have protocols, and you're going to get whatever is built into that protocol. But I think AI has some good uses, but I don't know. It's there's just something about it that doesn't sit well with me. And I'll leave you with this. So the other day I was looking for something. Someone had told me about Grok on Twitter or on X, and so I asked it some questions about something I was interested in, and then I just asked it something completely different, and it the Grok feature, I would say, scolded me a bit for changing the subject. So I was a bit taken aback by that. So anyway, but it'd be interesting to hear your thoughts on AI. And well, I just wanted to give you this quick synopsis and have a healthy day.